My name is Professor Uziэli. I'm a senior oncologist, mainly thyroid cancer and breast cancer. It's a tertiary hospital. It means that people are coming even from as a referral. First of all, I have to tell you that thyroid cancer, usually people are well after surgery. Okay, my name is Professor Uziэli. I'm a senior oncologist. I used to be a head of the daycare unit here, and now I'm a senior physician here. I treat mainly thyroid cancer and breast cancer. Maybe I'll start a little bit with thyroid cancer. People know that thyroid cancer needs to be a first surgery, to have a surgery operation. And then if it's a local, more than 4 centimeters or lymph node involvement, then we give iodine. But sometimes we know that thyroid cancer is also, people suffer from metastases. And the new things in thyroid cancer, we know that we have biological treatment, which we didn't have before, which is very important because we can treat people either with Lenvima or other biological treatments. We sent everybody with breast cancer for a mutation rule out to find out if the patient have special mutation. We know that we have treatments for special mutation as well. And so that's the thyroid in very short and brief sentences. And about breast cancer. Breast cancer is a big disease, a large basket of diseases. We have many kinds of, triple negative, HER2 positive, estrogen receptor positive. So it depends on each one of them how we treat the patient. And of course it depends on the staging. If the patient is early stage, then it's different than metastatic. When we are talking about the metastatic, usually people know that we have, of course, letrozole or aromatase inhibitors, but now we don't give aromatase inhibitors only. We give them with CDK inhibitors as well, which is a biological treatment. That's the first line. Now we also give, we try to find out more specific treatments. It depends on mutation. If the patient has a mutation on PI3 kinase, then we have now treatments against that mutation. Sometimes it's only one drug. Sometimes we have a lot of studies which are showing us now that triple treatments, even in breast cancer, estrogen receptor positive, if there is a PI3 kinase mutation, it's better than 2 drugs or 1 drug. So that's what we are going to that. And also, we have another mutation, ESR1 mutation, which is usually a mutation which the disease is not with that mutation to start with, but usually after treatment with other drugs like aromatase inhibitor, it became that mutation, you have it. So usually what we do, we have also specific treatment against ESR1 mutation. Yes. As well, we treat if they have bone metastasis, we give also Zometa, which is a bisphosphonate to prevent hypercalcemia and to prevent the breakage of the skeleton. So it depends on the study. Each study has its own demands. Depends what the study wants. But usually we recruit patients which are Not at the end of life, that's of course. The patient has to be some kind, can walk and speak and be eligible to sign, of course. Usually what we call echo performance status 1, 0, 1. Sometimes 2, but usually it's 0, 1. And it depends what the study demands are. Sometimes you need to have a special mutation, so you send the pathology to the study to check out if they have the special mutation, or if not, if they have measurable disease. It depends on the study. It's a tertiary hospital. It means that people are coming even from as a referral to us, and we have all kinds and all modalities. We have radiation therapy. We have here studies, many studies, and we try to participate in most of the studies that are international studies. It's important because then you can offer a study to patients if you don't have something which is registered already. We have a multidisciplinary team so we can discuss in between ourselves. We have orthopedic surgeon, we have surgeons, even that, so people can ask others and decide together. First of all, I have to tell you that thyroid cancer, usually people well after surgery, most of them don't need any treatment, only replacement if they need replacement therapy because they don't have thyroid, so sometimes they need thyroxine. So most of them are well for their life. Surgery and that's it. Only the minority, they have metastasis afterwards, and even those with metastasis, they live a very, very long life. That it has to be well-known. It's known that thyroid cancer, you don't die from thyroid cancer if it's been diagnosed early enough. Thyroid, usually it's young, but if you are young, your prognosis is better than old patients. And young, I mean even the 20s, 30s, many of them. Breast cancer, they are older than that, but we have breast cancer in their 20s and 30s as well.